When was the last time you thought about your penis outside of sex or when something felt wrong? For most men, the answer is rarely, if ever. But your penis, like your heart, your skin, or your teeth, needs regular care to stay healthy and functional. Neglecting this can lead to infections, performance issues, and even serious long-term health problems. The good news: proper care isn't complicated. Just 5 simple habits can make all the difference. Today, we're going to break down the 5 essential steps every man should take to maintain penile health. Whether you're in your 20s, 50s, or beyond, these tips will help you stay confident and healthy, and trust me. Tip number 5 is one most men have never considered. Hygiene is the foundation of penile health. Yet, so many men either skip it or do it incorrectly. Let's clear this up. If you're uncircumcised, gently retract the foreskin and wash underneath with warm water daily. Why? Because this area is prone to a natural buildup of oils, sweat, dead skin cells, and bacteria. This forms what's called smegma. Left uncleaned, smegma can lead to irritation, foul odor, and even infections like balanitis and inflammation of the glands that can be painful and embarrassing. If you're circumcised, you're not off the hook. Clean around the glands and along the shaft with warm water. Use mild, unscented soap sparingly, because harsh soaps and body washes can strip the delicate skin of its natural oils, leading to dryness, cracking, and itching. Avoid scrubbing aggressively. The skin here is thinner and more sensitive than most parts of your body. Pat dry gently after washing to prevent chafing, and don't forget the surrounding areas: pubic hair, groin folds, and the base of the penis. Keeping these areas clean reduces sweat accumulation and lowers the risk of fungal infections. Good hygiene also helps with early detection. While washing, take a moment to look for any unusual lumps, sores, or discolorations. In short, clean daily, be gentle, and respect your body's natural balance. Did you know your penis needs regular exercise? I'm not joking. Erections are not just a sign of sexual health. They help maintain it. During an erection, blood fills the spongy tissue called the corpora cavernosa, stretching and nourishing it. This influx of oxygen-rich blood keeps the tissue elastic and functional. Without regular erections, these tissues can lose flexibility, leading to a condition called fibrosis, which makes it harder to achieve firmness later on. Research even shows that men who remain sexually active as they age are less likely to develop erectile dysfunction. This doesn't mean you need to have frequent sex. Even occasional erections, whether with a partner or through masturbation, help keep the system in shape. But here's the caveat: moderation. Overstimulation or aggressive habits can cause micro-tears, desensitization, or even Peyronie's disease, where scar tissue causes painful curvature of the penis. To keep things healthy, vary your stimulation techniques. Change positions, pressure, and rhythm. And if you're practicing self-pleasure, use a good quality, water-based lubricant to prevent friction injuries. Think of this as maintenance, like keeping a car engine running smoothly. Regular use prevents parts from seizing up, but don't overdo it. Listen to your body. Most men don't realize they should be performing monthly self-checks of their penis and testicles. Yet this simple habit can catch problems early and save lives. Here's how to do it. Once a month, preferably after a warm shower when the scrotal skin is relaxed, gently roll each testicle between your thumb and fingers. You're checking for unusual lumps, hard areas, or changes in size. A normal testicle feels smooth and slightly firm, like a boiled egg. Any irregularity, especially painless lumps, should be checked by a doctor promptly. While you're there, examine the penis itself. Look for any sores, ulcers, changes in color, or areas of thickened skin. Pay attention to curvature that wasn't there before, which could indicate early Peyronie's disease. Also check for signs of infections like redness, swelling, or discharge from the urethra. These can often be caught early before they become serious. Early detection is key. Testicular cancer, for example, is highly treatable if caught early, but often ignored because men simply don't check. So take 2 minutes once a month. It's a small investment for your health. Your penis doesn't exist in isolation. It's part of your vascular system, meaning its health depends directly on your lifestyle choices. Smoking is one of the biggest enemies of erectile function. It damages blood vessels, reducing blood flow to the penis. Heavy drinking, obesity, and high cholesterol have similar effects. But here's the good news: what's good for your heart is good for your penis. A Mediterranean-style diet rich in vegetables, fruits, lean proteins, and healthy fats supports blood flow. Regular exercise, even 30 minutes of brisk walking a day, can significantly improve erectile performance by improving circulation. Sleep is another critical factor. Poor sleep lowers testosterone and increases stress hormones like cortisol, both of which negatively affect libido and erections. Stress management matters too. Chronic stress tightens blood vessels and raises blood pressure, restricting blood flow where you need it most. In essence, a healthy lifestyle equals a healthy sex life. Finally, protection. Your penis is a sensitive organ, both mechanically and biologically. Let's start with infections. Sexually transmitted infections, STIs like herpes, syphilis, and chlamydia can cause painful sores, discharge, and long-term damage if left untreated. Using condoms consistently and getting tested regularly if you're sexually active with multiple partners are non-negotiables. Next, mechanical injury. Believe it or not, penile fractures, where the tunica albuginea tears, are real. They typically happen during rough sex or awkward positions that cause bending. Always prioritize comfort over acrobatics and avoid excessive force. If you use sex toys or engage in adventurous play, educate yourself on safe practices. And avoid prolonged pressure on the groin area, like sitting awkwardly or using poorly designed bike seats, which can compress nerves and reduce sensation. Think of protection as an insurance policy. It preserves your health and ensures your sexual function remains intact well into your later years. Your penis is an incredible organ, complex, sensitive, and absolutely deserving of care. With these 5 simple habits, you can keep it healthy, functional, and ready for whatever life brings. Which of these tips surprised you the most? Have you already been practicing some of them? Share your thoughts in the comments below. Let's normalize this vital conversation for men's health. If you found this video helpful, give it a thumbs up and subscribe for more science-backed advice on men's wellness. And hit the bell so you never miss an update. Stay healthy, stay confident. I'll see you in the next video.